Eritrea and the Kingdom of Eswatini have registered their first coronavirus cases. Meanwhile, Mauritius and the Democratic Republic of Congo have also become the latest African countries to report deaths from the coronavirus. Zanzibar, which relies heavily on tourism, has shut down 95% of its hotels. On the African continent, Egypt is the hardest hit country with 285 cases and 8 deaths, followed by South Africa with 240 cases but no deaths. Zimbabwe has now 2 cases of the infection, while Eswatini has reported that all 27 suspected cases have tested negative for the infection. Globally, over 11,000 deaths have been registered, with more than 270,000 infections recorded. Zimbabwe has reported its second confirmed case of the coronavirus. This follows the first case of a 38-year-old from Victoria Falls had traveled to the United Kingdom earlier this month. The number of SADC countries with COVID-19 cases stands at 7. Globally, more than 200,000 people have been infected by the viral infections, of which over 8,000 have died.
Today, the 21st of March 2020, the National Microbiology Reference Laboratory at the Salim Gale Central Hospital confirmed yet another case of COVID-19, which brings to 2 the number of confirmed cases of COVID-19 in Zimbabwe. This second patient is a 30-year-old male resident in Harare who had traveled to New York, United States of America, on the 29th of February 2020. And returned home in Harare on the 9th of March 2020, and he came through Johannesburg. He started exhibiting mild symptoms, flu-like illness, on the 12th of March 2020, which progressively got worse on the 19th of March. He consulted his doctor, who advised him to self-isolate at home. The doctor alerted the local COVID-19 rapid response team that immediately went in to assess him and recommended that he continues with the self-isolation at home. Specimens were collected and sent to the reference laboratory for testing. Yesterday evening, he developed severe respiratory distress, and after stabilization at home, he was admitted for isolation and clinical management at Wilkins Hospital. The reference lab confirmed his COVID-19 positive results early this morning. Our teams are now engaged in contact tracing, and as with the first case, are being assisted by the patient himself. Once again, we call upon everyone to remain calm as we manage these confirmed cases of COVID-19 in Zimbabwe.